Welcome to another episode of the Level Up Infection Prevention Podcast, Season 3. I'm Michelle Strange, your host, and I am passionate about equipping dental teams with the tools and knowledge to excel in patient safety and in infection prevention. Today, we are focusing on probably the most nuanced topic I will have in this season, and that is going to be Burs, your dental Burs. And I'm joined by Sarah Stream and her kitty, it seems. What kitty do we have here?
This is Ophelia. She always
Ophelia.
feels the need to help with work.
I love that. I'm just waiting for one of my cats to come across the screen too. But you have incredible expertise in this area. And so I'm so excited to learn from you and share your insights. So let's dive into this conversation. I actually am real curious. When you go and give people the business about dental burrs, how often is your life threatened?
I've never been threatened yet. I do get a lot of dirty looks, though.
I can imagine. So let's talk, like, what are we talking about, Sarah? What is the biggest issue here and how do we solve this?
Oh gosh, there are so many issues with burrs. I think the biggest issue is just a lack of understanding on how to read packaging and
Mm.
where to find the instructions for use. Because, it's one of my pet peeves with burrs is the distributors will grab like 20 burrs and bubble packs out of a package of 1,000. And so the end user never gets the instructions.
Oh, okay, that's new to me. So you mean like the distributors like Patterson, Henry Schein, Burkhart, Benka, all of those people, right? They're getting it from the manufacturer, and then whoever orders, they say they want 20 diamond 8s or whatever. I don't even know. It's been so long since I've done any of those burr things, but they're gonna grab those 20 and then they don't include the instructions. Is that what I
Right.
hear?
Yeah. Because
Oh,
they
interesting.
buy those burrs in bulk. So they get
Mhm.
like a package of 1,000 or a package of 5,000 or whatever it is. So they'll just grab 20 little bubble packs with burrs in them and rubber band them together and throw them in your order. There are a lot of burrs though that are like just a package of 100 in a box and you get the whole box, which is great.
Mhm.
But there's also this issue of we're just not getting the instructions.
And if we were to get those instructions, what would we find with them on them? How would we read?
Every manufacturer has different instructions for their burrs. I guess to start out with, the FDA hasn't cleared any diamond burrs for reprocessing.
This is where
That
I was asking about your life and is it
Yes,
safe? Are you safe?
yes.
Because I know
I
when you
am
tell people that, they get real upset. They're real about it.
Yeah, and another frustration for me is that some manufacturers of dental burrs have found this weird workaround through the FDA. So they're classifying these things as rotary instruments and not as dental burrs. So sometimes you'll get a diamond burr that has reprocessing instructions with it, but is not classified as a dental burr through the FDA.
Okay. My first question that I would love for you to clarify for me, what is a rotary instrument and how does a burr fall into that?
Honestly, I have no idea.
Okay.
I don't know what the difference is. I really don't. There are these two different categories, so dental burrs and
Okay.
rotary instruments. I don't know how they're different. I don't know if like the rotary instrument category was intended for like endo rotary instruments or some sort of something or other. There are manufacturers that are throwing diamond burrs into that category
Mm.
because the FDA works in a really weird way. So once something has an approval to be reprocessed, then everything else that falls under that category automatically has that approval as long as you can provide the instructions. Diamond burrs have not taken that step yet. So manufacturers have
Okay.
not gone through the validation process with diamond burrs with the FDA for reprocessing. So if it's classified as a diamond burr via the FDA, all of those are single use.
Okay. And when a diamond burr falls into the rotary instrument category and has reprocessing instructions, is it possible for a dental team to actually accomplish those? Because it feels like, would I need special tools, special enzymatics, something because that's a lot of nooks and crannies, magnify glasses or magnifiers of some sort. Like, what would I need?
I believe the IFUs for those rotary instruments, they're just like a standard run it through the ultrasonic, make sure it's rinsed, dried, inspect it, package it. They do have specific sterilization parameters, just like any other IFU for any instrument or whatever you're using. I don't think there's a need for special equipment.
Okay.
It really grosses me out though, because it's like trying to clean sandpaper. You just can't clean it.
I mean, which is where I was curious about, like, is there some kind of, like, wire bristle brush that, like, because it doesn't make sense. How are we getting into those nooks and crannies? And then if we know anything about sterilization, we know we cannot sterilize an unclean surface.
Right.
So how are we getting into those little sandpaper nooks and crannies with just an enzymatic cleaner and a little ultrasonic?
Right.
Okay. So that's diamond burrs. Technically, I feel comfortable saying those are single use, even though maybe there are certain manufacturers' instructions for use that say it's a rotary instrument. What about carbide burrs?
Carbide burrs, there are quite a few out there that you can reprocess. And those pretty much follow the standard cleaning, sterilization, ultrasonic, inspect it, package it. Some of them get a little specific on like when they're in the packaging, you shouldn't have more than one because you don't want them to contact each other, cause corrosion and those sorts of things.
Mhm.
But as long as you're following the whatever IFUs for the burr you're using, then at the end of the day, as an end user, if you're following the IFUs, you are covered from legality.
Okay, so then I guess this is where it gets a lot more complicated because I mean, you and I have been in dentistry for many a years now. How do we keep track of what burrs need what?
That
Like
is
when
a
I
great
get a burr
question.
block and it's got 6 different carbide burrs and a diamond and all these are like, how do I know?
Right.
Especially as a
And
hygienist, you're an assistant, so you obviously have way more knowledge, but I'm like, aren't they all the same? There's one's smaller, one's bigger. I don't know.
and that's a really tough question. Some burrs that can be reprocessed say like don't use it more than 5 times. How do you know how many times
Oh my
you've
gosh, another
sterilized
layer.
it? Right. Like you
Yeah.
can't like grab a Sharpie and put a little mark on it every time you run it through the sterilizer. So there are some of those like really nuanced things that you have to work out in your office with whatever systems you have. I know when I was in clinical practice, the doctors I worked for, we had hundreds of different burrs
Yeah, that's what I'm
from,
thinking.
like 10 or 12 different manufacturers. And this was before I knew everything I now know about burrs. I was, as a baby dental assistant, I was like, oh, yeah, they just go in the burr block and we're just going to run them through there. And we didn't have separate sterilization cycles. And, I would recommend everyone get a magnifying glass in their sterilization area just for inspection, not only for burrs, but there are other really little, instrument tips that we may need to inspect.
Which is
But
something
yeah,
I'd never seen in a dental, sterilization center, but I am gonna start including because I do now see, like, how important that is. So, you mentioned the burr block. So, back when I was a baby hygienist and I did do surgical assisting, so I had some, like, assisting in ortho, but never, like, restorative, but we used some burrs and stuff. So, let's say I get that burr block out back in the day, and we use the burrs and put them back, and we would reprocess it. And now what I have started doing with these offices that do accept this new information as single use and actually make changes, which is a hard one, we would unwrap the or the like, let's say we're doing a certain restorative procedure, put all the necessary ones in there, sterilize that burr block, but none of them have been used on anybody. And then those are discarded single use in the sharps container afterwards. And that's how we were using the burr blocks in the offices that chose to make some changes. Is that correct? Or do you have a better way of doing that?
once again, it depends on the IFU. Some burrs say you can
Yeah.
put them in a burr block to be sterilized. Some say they should be packaged to be sterilized.
Oh.
Some are
Oh my
packaged
goodness.
sterile, but if they're not packaged
Right.
sterile, they will say, you need to sterilize them before the first use. Yeah. A lot of times if you buy in bulk, like I remember we would get like a box of 500 330 burrs that are just all in a little tiny box. They're not in the individual bubble packs. Those are
Mhm.
not packaged sterile. So those should be sterilized before the first use.
But then we gotta, like, read even deeper to see if I can do it in a bird block or if it needs to be
Right.
separate. Oh, you know, and this is where I feel the pain of some clinicians that are just like, "So exhausting. How do we keep up with all of this?" I mean, do you get that a lot too in this conversation?
Yeah, I do. And there are always a lot of questions around burrs. I think the easiest thing, if we lived in a perfect world, the easiest thing to do would be to buy individually packaged, sterilized, single-use burrs. So
Mhm.
you could just get your little package of your one burr that you need for that procedure. It's already sterile. You don't have to worry about sterilizing it before the first use. Stick it in your burr block for the procedure, and then in the sharps it goes when you're finished.
Yeah, that does sound like the best system. And then you would just gather all your burrs, you put them in the burr blocks once you're open, that way people can grab easy and then be done with it. Yeah, I like that. So we've talked about diamonds, we talked about carbides. Are there any other endophiles? I hear that a lot. Is that in the same
Endophiles
category?
are the same. Yeah, they fall in that same category.
Okay.
Um, they, some of them are single use, some of them can be sterilized, some you have to sterilize before the first use. Also, inspection of endoburs is really important because, there's that torque on the burr itself or on the when they're trying to like shape the canal of the tooth. So they get bent and stretched out very easily.
Mhm. Mhm.
And if you miss that and reuse it, there's a very good possibility it could break off in someone's tooth. And then that's a
Oh,
bad,
yikes.
bad deal.
So and I guess for these instruments, if they have passed FDA approval for cleaning and reusing, then they are okay in our autoclave being heated repeatedly. I guess this is where the X amount of times
Mhm.
you can't do it because is that what's happening? It's like the use and the heat and the things are weakening the metals.
Yeah. And there was a really good study out of Brazil this last year. I can't remember. I can't remember it off the top of my head. I'll send you a link if you want to drop it in the show
And we could
notes.
put it in notes. Yeah,
Yeah.
perfect.
But they tested diamond and carbide burrs after so many uses for a procedure and then so many sterilizations. So you could see what was happening. And they did scanning electron microscope photographs of the burrs.
Good. Is
So
it?
you can see how damaged they are. You can see all of the gross stuff that's stuck to the diamond part of it when it's after it's been sterilized. There's
Wow.
still like stuff there.
Yikes. I kind of like think in my head, like, it wouldn't make any sense for us to ever reuse blades or scalpels, but but a cutting tool that is a burr, we use again and
Right.
again, which is wild. That's wild.
Yeah. And they're critical instruments. So
Right. Can you tell the audience what critical means in this Spalding's classification?
yeah. So another funny thing, when I was a baby dental assistant, we learned about non-critical, semi-critical, critical instruments, but I never knew that it was called the Spalding classification
Oh,
until like 3 years ago.
feel like they existed. I didn't know there was a name for it.
Right, right. But this is a classification of how we use medical devices and instruments and the level of disinfection or sterilization that's required for each level. So if an item is non-critical, it comes into contact with intact skin. So I would say this is something like an XCP ring that touches the outside of
Mhm.
a person's cheek. A semi-critical instrument comes into contact with intact mucous membranes. And then our critical instruments have the potential to penetrate soft tissue or bone. So that's where that burr comes in. Like we're using it to penetrate enamel, to do preps, or potentially bone and oral surgery procedures. So, with it being a critical instrument, it has to be heat sterilized between each patient.
Which obviously makes sense. And the cleaning step is so vital, which is what you would mention. You can't really get things out of sandpaper. just our issue with the diamond burrs, because that
Right.
cleaning step is so vital to actual sterilization protocols and if it even gets sterilized. I'm
Absolutely.
curious, are there any other parts of this conversation where people ask a lot of questions or you get a lot of pushback?
I think the other question I get is when we get these little single bubble packs from our
Mhm.
distributor, how do you tell if it's single use? Like, how do you
Because the
know?
instructions aren't coming with it, right? Is that what you're
Right.
saying?
And packaging for medical devices has a whole bunch of symbols on it. I'm sure you've seen like all the little
The
umbrella and the little thermometer, which is your temperature variation. Um, but knowing what those symbols are can be very helpful. If you see a little circle with a slash through it with a 2 in the middle, that means do not reuse it. It is a single use item.
single use, yes.
Single use. Yes.
And we do know, like, and we've talked about this at ADS, which is the Academy for Dental Safety. It used to be OSAP. You and I are both members and are there every year. One of the conversations that we have a lot are around the FDA guidance. How do things like this happen with burrs getting into rotary instruments? And then manufacturer's instructions being super clear. In fact, I just ran across one because I use a very specific cassette for my dental instruments. And there was this random time and temperature that went with it, which was like 273 at 5 minutes, whereas my instruments were saying 270 at 4 minutes. And then I was like, why would I do something at a higher temperature for a longer amount of time? Like, so there was all the things were all over the place. And I think there's got to be a lot of cleanup with that, like manufacturers helping guide us so that we aren't playing this guessing game constantly with our instruments and the right protocols.
Oh yeah. IFUs are the most confusing thing in the world. And I'll be very honest, a lot of them are hard to find. If you don't get them with
Yep.
the package, like I have spent hours and hours digging on sites for manufacturers trying to find instructions on one stupid little thing that I'm looking for. And it's my job to do that. Like, so, I can only imagine being back as a clinical dental assistant with everything else I have going on. I don't have
Yeah.
time to dig for IFUs, try and match them up between manufacturers. So that way we're making sure everything is running the way it should be. So it's super difficult for the end user. And I think that we have an opportunity to voice our concern in this as end users. Like we have a right to say what we need, right? So reaching out to the FDA and just kind of reporting that, everything is really confusing. Maybe we need a standardized process. Maybe we need a standardized IFU format. That would be super helpful. Kind of like the SDS sheets.
How does one complain to the FDA?
Ooh, that's a good question. I would have to look up where you could reach out to them. I know there are some device reporting portals that you
Mhm.
can use. Another thing as an end user, we really have a responsibility to report if we have issues with an item.
Oh, okay. Mhm.
Otherwise, nobody knows what the issues are, right? So if you have a burr that breaks or the IFUs are confusing and you can't understand them, or you have some other issue with a device that is FDA approved, they need to know about it so they can work with the manufacturer and fix the problem.
And if we can find that information to the audience listening, there it will be in the show notes, so go check that out if we can get some links for you because maybe that's what we can do. Like we can really start pushing for this from the FDA. And if there's enough of us, maybe we can get some change.
Yeah.
Cause it is annoying. I agree. Like I'm barely surviving the day seeing patients and and I love an IFU, like I love to go read an IFU, but the amount of times I am humbled by an IFU is, and by IFU, if y'all didn't catch it earlier, we mean instructions for use. Like, every time I think I know something about a product that I'm using or, that I'm doing my water lines correctly or whatever, I swear I'll go read that IFU and I'm like, "Oh my god, how did I miss that?"
Yeah. Yeah. There's a lot. And, I go into a lot of offices and we do a lot of support for dental facilities and we get questions on equipment and instruments and all of those sorts of things all the time. And my first question to that person is, have you read the IFU? Let's go look at it together. Do you even have it? I guess is the first
Mhm.
question, right? Do you know where it's at? And a lot of times they don't know. Like, they
Yeah.
just don't know.
Yeah.
It's that legacy education, right? So and so before me trained me how to use a sterilizer, and we use this one cycle.
Mhm. Yep, and you'll hear this in the season a few times. We talk about legacy errors. Legacy education is a great one. Like, I was taught by 2 assistants before me, and that's the way they did it. This is the way I do it, and how problematic that can be, uh, when we're talking about equipment maintenance and patient safety and our safety too. I do have one last question that is not exactly about Burs, but something that just came up, and I'd love to hear if you have a thought on this. And it is around, it's kind of close to this handpiece maintenance. So if I asked you, okay, in the sterilization reprocessing workflow, we have our little machine that lubricates them, right? Would you say that happens in the receiving section before ultrasonic? Or would it be now, and I say that knowing hand pieces are not going in the ultrasonic, but like just in that flow where we put our stuff down, zoop, zoop, put it, and then it goes to the other side? Or would you have your little device over where the packaging side is to be kind of wiped down and then lubricated and call it a day? Or does it matter at all?
For that one, I don't think it matters.
Okay.
For me personally, because
That's
they
kinda
don't
where I was
go.
leaning to.
Yeah, they don't go in the ultrasonic like you said. Most of them you would wipe them down with a gauze or something alcohol or something like that as a pre-clean. But as long as it's in that workflow somewhere, it should be on the dirty side, right? Not after
Yeah.
they're packaged and sterilized. But I think wherever space makes sense for their workflow.
Okay. That just came up, and I had somebody that was like, "I've never seen it on the receiving side. I've only seen it," and I was like, "I've actually only seen it on the receiving side, because we would just, like, get rid of all the stuff, well, technically, you should get rid of your disposables before you leave the operatory, but sometimes gauze sticks around, whatever. You toss that away. We zips, do our little lubricating. It goes over, and then the stuff goes into the ultrasonic, and so we were just having this philosophical debate on and I was like, "I don't know if it actually matter."
I don't for that one, I don't think it matters.
Okay.
Yeah.
Well, any other, like, final thoughts on the Burr conversation? Anything that you're teaching a lot, again, like you say often, that we did not touch on?
I think I guess for the end users out there, it is confusing, and you're not the only one that's confused. Uh,
Amen.
and I used to work for a dentist who was very, very frugal, and telling him that every single diamond burr is single use, he would have had an aneurysm. You have to pick your battles. If you can find another version, because some of them are expensive. If you can find another
Mhm,
version, an alternate version that your doctor likes, that they're okay with it being single use, that's
mhm.
probably your best option. But, this may be a battle that's never won, unfortunately.
And if you're a patient that is listening to this randomly, ask. Start asking, because I think it's gonna be a patient or a big thing that happens. That's usually what gets the shift and the push for things to change. But I think this is all very helpful, a little worrisome, but very helpful. And if anybody has more questions or wants to reach out to you, listen to your podcast, or any of the things that you're doing in the world, where can they find you?
So I'm on Facebook. You can find me. I'm Sarah Stream on Facebook, or you can go to my consulting page, Stream Education and Consulting. And I don't post on there as often as I should,
Uh,
but
Me too.
um, feel free to find me on Facebook. You can find my email address through Facebook if you have questions. I
I'll put it in the
also
note.
am, my full time gig right now is with the Nebraska Department of Health and Human Services through the Nebraska ICAP team. So we have a dental support program for the state of Nebraska, and our website has tons of resources. We do a dental focused podcast. It's called the Mouthy IP. So if you are a podcast listener, which you probably are if you're listening to this,
Right.
you can find that show as well. And I'm always happy to help if people have questions.
You're always helping me, so I appreciate you. Well, thank you so much for your education today and all the discussion. I really appreciate you coming on and definitely reach out to Sarah, follow her on Facebook, and come to an OSAP or ADS meeting and meet us both.
Yeah, we'll be sticking together at annual conference.
So lovely. I'm
Yeah, it was
excited.
yes.
Well, thank you so much, Sarah.
Thank you for having me, Michelle. It was great.
Thank you for listening to season 3 of the Level Up Infection Prevention podcast. Don't forget to follow or connect with the guest. And while you're at it, follow me on Instagram, Level Up Infection Prevention. And check out levelupip.com for more details on all the digital courses and the Infection Control Coordinator's Guidebook.